I'm Dr. Rick Greene from the UVA Medical School class of 1970, and it's my great pleasure today to host another in our series of interviewing our wonderful emeritus faculty and previous faculty and current faculty at the University of Virginia. And today it's especially a pleasure to talk to Dr. Bob Cantrell, well-known past chair of ENT, internationally and nationally known otolaryngologist. So Bob, thank you very much for being with us today.
My pleasure.
You know, I want to ask you, I know a little about you. I think you were in the Navy.
I was.
I was in the Navy. I was a surgeon on a nuclear carrier. And I think you were out in San Diego for a while.
I was.
Tell me a little about your military experience and how that, where did that fit into the rest of what you've done in your life?
Well, I went to the Naval Academy first.
I did not know that.
But after, in the middle of my third year there, I decided to resign and study medicine. Now you can go through the Naval Academy and become a physician, but they couldn't do it in those days.
I see.
And I decided to become a physician, and so I had to resign, which I did. And then I returned to the Navy at the end of my freshman year of medical school, worked that summer at the experimental diving unit up in Washington, in the Navy Yard, doing respiratory physiology. It was a wonderful experience. This following summer I worked at Bethesda Naval Hospital, and then I had my first year of surgery training in New York at Cornell. But in those days there was a draft, and you had to go in the draft after your first year. So I did that, and I had chosen to go with the Marines and went to Westpac with 3rd Marine Division on Okinawa. I was an infantry battalion surgeon, and it was. Some people would think that's not fun, but I tell you, it was the best time of my life. You were only supposed to be out there for 13 months, but I stayed longer and then came back, and I was there a total of 3 years. So, and following that, I had training in otolaryngology at the National Naval Medical Center at Bethesda. Following which, I was posted to San Diego as the chair of the department, and I did that for 7 years until I got recruited here to the University of Virginia. One of my former friends from medical school he called me and asked me if I was interested, and I told him no. I'd been on active duty for 16 years, and so I told him no. And then he was very persistent. He called back, well, come on up and take a look. And so I did, and I was so impressed by UVA, and the faculty was so welcoming and kind, and I was impressed too. There in California, I was on the core curriculum committee in the Council for Educational Policy at UCSD, and the students were ratty, long hair and sandals. It's just not what I thought that doctors should look like, and so I'd sort of given up on that. But I came back here, and here the students are, and they're kind of dressed the way we did when I was in school.
Still coats and ties.
Coats and ties, yeah. And I thought, wow, well, maybe there is hope for medicine. And so I came, and that was in 1976. And I was the first full-time chairman. They'd had a department of otolaryngology here since 1907, but it was a geographic full-time, and they had superb doctors in town. But they were in private practice, and they would come to the university and do their operations and so forth. And they had a wonderful tradition here, and they started training residents in 1922. And but the program didn't possess the academic requirements that people think of a medical center, academic medical center, or the research. And so that was one of my jobs. Was not the clinical side of the program was superb. I would say unexcelled ever. G. Slaughter Fitzhugh was the chair for many years before that, and he was well beloved. As a matter of fact, the class of 1961 gave him the Robley Douglason Award.
Yes.
And 6 of the people in that class went into otolaryngology to show you the impact that he'd had. Well, anyway, we had a wonderful staff. I recruited good people. We had established a research. I had a full-time PhD research person, and I might add that this person who was doing research on the regeneration of hair cells, the inner ear hair cells, and he had some breakthroughs because they had thought that only that could happen, the regeneration in salamanders and lower animals, but in fact we in his labs showed that it could be done in chickens, which raises the possibility of going forward that you might be able to do this in humans. And that work done here has spurred the similar work in 3 other labs across the country. So one of these days we hope that we'll be able to regenerate hair cells, because it's the most common disability in the world. 10% of the population in the world has hearing loss, but it doesn't hurt, so nobody does much about it, except when the wife gets upset with the husband for the TV being too loud.
Which happens frequently.
Yes. Anyway, we also, Slaughter Fitzhugh had established a referral network from the central Atlantic region, and had a large following in head and neck cancer. And so we inherited that, and it was really more than I could handle. I had to recruit another head and neck surgeon, and so we sort of divided. In those days, there weren't so many subspecialties,
Right.
but now there are, you know. And so we had some people we recruited who just did ear surgery, and then there were 2 of us doing head and neck cancer surgery, and the program did well and got national recognition, and we enjoyed. You know, in 1990, I think it was, U.S. News and World Report started rating universities and
Yes.
medical centers, and then in the medical center itself, they would rate the departments. And I'm happy to report that at the University of Virginia, otolaryngology for those years was always the best, #1 rated department in the University of Virginia. And so I was very pleased with that. So at any rate, then in 1994, John Castine asked me if I would be willing to be the acting vice president and provost for the health system. And I thought about it for a little bit. In fact, I asked the wife, I said, it was on a Saturday that he made the offer, and I said, let me think about this over the weekend, give it some prayerful consideration, and talk to my wife. So I asked her, and she said, do we have to move on the lawn? And I said, no. She said, well, then it's okay. Because she'd heard stories. One of our good friends told about coming home to, he lived in the pavilion, and he came home, and there's a guy in there reading the newspaper, strangers. Anyway, so I was, that acting position didn't last very long, because they made me the full-time vice president and provost until 2001. I had 7 years of that. So.
Well, I wanted to maybe explore a little. I mean, obviously, otolaryngology is your field, but what brought you into the field? What was it about that field of surgery that really enticed you to join?
Well, I'll tell you, interestingly, when I graduated, my junior year of medical school, I was planning to be an internist. I was so impressed by the way these fellows thought and so forth. But after that summer, I worked at Children's Hospital in Washington, and they let me do a lot of surgery. And plus the fact that I always, as a kid, I did models and did things with my hands. And so I decided that I was going to become an internist who used surgery as a form of therapy. Of course, you have to have surgery training. And that's why I then went to New York.
Sure.
And after about a week there, I knew that general surgery wasn't for me. Those fellows worked really hard, and we did too. It was every other night on, and except for 18 weeks, which was 3 out of 4, 4 out of 5 nights on. So when I went in the Navy and was overseas, I had some time to think about what I was going to do. So I knew I wanted to be in a surgical specialty, and I knew I was thinking seriously about plastic surgery and urology and otolaryngology. And to be fair, I didn't really know very much about either of those latter two. I knew a little bit about plastic surgery. But that was, they wanted you to go through general surgery and then have 2 or 3 years of plastic surgery, and I thought that was more training than I needed. So I left it to urology and otolaryngology, and I just felt that maybe urology was a little wet, and I would
You were right.
and I would stick with otolaryngology. But when I went into otolaryngology, I thought I'd made a mistake, because here were these guys that were looking in little holes that and I couldn't see anything. But then they started me doing tonsillectomies, and once I got with a knife in my hand, I knew that was right. And we, you know, otolaryngology is really a medical specialty, because we see 10 people before we find one that we operate on and treat medically. And so that's what we did. And I've always been happy with that decision. And so,
well, we're glad you made that decision. What do you enjoy doing now? What really gives you a kick getting up in the morning? What are your thoughts about that?
well, you know, I have a farm west of town, and it's a working farm. I have all of those, you know, tractors and things, but I've got 19 acres of timber, which trying to stay ahead of that is a problem. And I used to wield that chainsaw with I don't do that anymore. I've stopped. I hired that done. And, but that's one of my passions. I have 4 children, 2 who live here and 2 who live in Boulder, Colorado, and I travel back and forth a lot between those 2 areas. And so I just enjoy life. I used to do a lot of photography. I don't do that so much anymore, because photography, you know, they've gotten all these little cameras. Everybody's got a little camera, and they take incredibly good pictures, you know. And in videos, you know, as we know, every time a policeman stops anybody, he's getting videoed. So, but I read a lot. I didn't get a chance to read as much when I was active, and I've been very busy reading, and I enjoy that very much. And so,
Well, I just want to, on behalf of the Alumni Association, thank you for everything you've done for this university and everything you continue to do. We've been talking to Dr. Bob Cantrell, former chair of ENT, former provost, member of the Health Services Foundation, done everything here at UVA. So Bob, thank you very much.
thank you.
Especially as a Navy surgeon.
Yes, indeed.